do your areolae look different? One a little different than the other. So if you're not sure, the areola is the colored circular part around your nipple. And in some people, one may look quite a bit different than another. Now, there are a lot of reasons that this can happen. So what are some of the causes after having breast surgery? Well, if there was tension and you had a breast lift, then the tension can widen one or both of your areolae. And the tension basically is caused by removal of skin as well as placement of an implant. And this tension, especially if you have a donut type of lift or a circular lift around your areolae, that can cause them one or both to widen. And sometimes it can cause them to widen in different ways. This type of widening or changing of your areolae are more common if you have short scar lifts. So if you have a short scar lift, in my opinion, sometimes they will rob Peter to pay Paul. And the reason why I say it this way is somebody may have a lot of droopiness to their breast, a patient may, and in that situation, what I would typically recommend would be an anchor scar when we do a lift, a scar that extends all the way around the areola, comes down, and goes underneath your breast. However, other surgeons may say, hey, you know what, let's shorten that scar, because why do you want the scar below? Let's make that smaller, and I can do it with a vertical scar, like a lollipop, or worst case scenario, some people may even say, I can just do it with a donut scar. Well, what happens in those situations then is you get a lot of tension when they try to do it this way. You can get wrinkling around the scars, and you can get a lot of tension around the areola. And that tension you may not see so much initially when you're healing, but you give it 2, 3, 4, 6 months later, and what used to be an areola that's the size of, let's say, a $50, all of a sudden becomes oblong and wide and looks really strange. And that's the consequence sometimes of doing a short scar breast lift in somebody who needs a longer scar. Okay, and so fairly commonly, that's one reason why I will revise and try to make areolas or areolae look different, because that patient has had a breast lift done with a short scar technique when it probably should have been done with a longer scar. Adding that longer scar allows the tension to be redistributed to other scars like the underneath scar, and that in and of itself a lot of times will prevent the areola from changing very much. Sometimes the areolae change due to weight gain and weight loss. That can happen. Sometimes it's just a surgical error. You know, there are some surgeons, unfortunately, that don't take a lot of time when they're insaying the areolae. Say they may not care so much that they look different one side to the other, and so that's something that you would typically see right after surgery. A lot of times, some minor asymmetries will, within 6 to 12 months, even themselves out. But not always, and that could be another reason why you have areolae that look different. And then finally, it could be a genetic predisposition, and this is something that's not so much caused after surgery, but something that you can be born or develop. So how do you treat it? Well, if one of the areolas are too wide, then you can do an areola reduction with a lift, and this is one that you can do with a circular scar or a donut type of a lift. This is a fairly simple operation. It's not my favorite one, though, and I kind of mentioned earlier that if there's too much tension around the areola, even though you only have that circular scar, which is a great idea, you think, well, that scar can widen, the areola can widen, and you can go from having a wide areola with no scars to a wide areola with scars. So something that we would want to see you in a face-to-face consultation. We can discuss whether this might work for you. This can work if there's minimal tension, though. So if you've got some loose skin already, if you don't have tight breast implants and things, then this may work for you, and we can talk about your individual situation at the time of a face-to-face consultation. Here's an example of a patient who had a circumareolar lift, or reduction basically, where the areola was reduced just utilizing the scar all the way around it. But in those cases that need more, then typically I would do more of a lift or a reduction depending on your situation. And this typically can occur after somebody has some breast augmentation and they already have some droopy breasts, and maybe they tried to do the circular lift and it didn't work and things widened. Other times, sometimes people have implants put in and they just don't do the lift, and one side looks a little different than the other. So there's a lot of reasons why this may occur, but the solution is the same. Is you basically do either a lollipop type of a lift if it's a modest to moderate amount of excess skin, or you do a full lift if there's a lot of excess skin. And you can see this patient, two very different breasts, and to make the areolae look the same, doing a lift and a full lift on one side, implants on both. So there's a lot of reasons why your areolae could look different, and there are a lot of options that we have to treat it. If it is after surgery, then most of the time what we would need to do is some type of a lift, whether it's a donut type of lift with a circular scar, a lollipop, or a full lift. That's usually what needs to be done to get them looking the same. I hope this has been very helpful for you. I'm happy to see you in the office in a face-to-face consultation.